This is my psychiatry recap. Overall, it was a 6-week long rotation. I did 3 weeks on outpatient adult and 3 weeks on inpatient child and adolescents. During my outpatient adult, I saw everything ranging from anxiety disorders, agoraphobia, schizophrenia, bipolar disorder, some sleep disturbances, ADHD. I saw a lot. And then during my inpatient child and adolescents, I saw a bunch of like pedophilic disorders, trauma, child abuse, neglect, major depressive disorders, suicide ideation. It was a ton. The inpatient setting was intense and it can be emotionally draining because you're seeing kids who have suicidal thoughts, who have aggression, irritability, neglect from their family, foster care, some abuse. So it could be really hard on someone. I did enjoy the rotation because I got to see both how to treat kids with mental disorders as well as adults. And then I also did a little bit of child outpatient. That was also a good way to see them in a different setting. And I learned a ton. Honestly, the work-life balance of this specialty was amazing. The earliest I got to my rotation was 8 o'clock, and that was if we had a patient at like 8:15 or 8:30. When I was working the outpatient child, I would get there around 7:30 because we had a patient at 8 o'clock, and my preceptor wanted to do some debriefing before we saw the patient. I like pharmacology, so I did like the pharmacology aspect. I learned tons about psych drugs, their side effects, when to prescribe certain medications, what's good for kids versus adults. The psych shelf was good. I thought it was hard because like all of the shelves are hard, but I would say it's very doable. Some of the resources I used to help with the psych shelf was UWorld. I used Online MedEd. I did emboss questions. I also did pre-test, and then I read the Psychiatry First Aid book. The Psychiatry First Aid book was really helpful, and honestly, everything you need to know for the shelf was in the Psychiatry First Aid book.